My name is Abhishek Mankar, a student of National Service Scheme from Pune University, studying in Vidya Pratishthan's Kamalnand Bajaj Institute of Engineering and Technology. Today I am going to talk briefly about the pandemic the world today is in. The coronavirus or COVID-19, scientifically termed as SARS-CoV-2 outbreak, was declared a public health emergency of international concern on 30th of January 2020. Chapter 1. The COVID-19. Now the virus has spread to almost every country, infecting at least 1 million people, whom we know and many more whom we do not know about. It has crashed economies and had broken the healthcare systems, filled hospitals and emptied public spaces. It has separated people from their workplaces and their friends. It has disrupted modern society on a scale that most living people have never witnessed. Now let's get to its origin, from where it has came. First, talking about the severe acute respiratory syndrome, the SARS. In 2003, following outbreak of severe acute respiratory syndrome, which had began in the prior year in Asia, and secondary cases elsewhere in the world, the World Health Organization issued a press release stating that a novel coronavirus identified by a number of laboratories was the causative agent for SARS. The virus has officially named the SARS coronavirus. About more than 8,000 were infected, about 10% of them who died. The second is the Middle East Respiratory Syndrome, the MERS. In September 2012, a new type of coronavirus was identified, initially called the novel coronavirus 2012, and now officially named as the Middle East Respiratory Syndrome coronavirus, the MERS-CoV. The World Health Organization issued a global alert soon after. The WHO updated on 28th of September 2012 said the virus did not seem to pass easily from person to person. It appeared the virus had trouble spreading from human to human, as most individuals were not affected due to the transmit of virus. By 30th of October 2013, there were 124 cases and 52 deaths in Saudi Arabia. Now talking about the coronavirus disease. In December 2019, a pneumonia outbreak was reported in Wuhan, China. On 31st of December 2019, the outbreak was traced to a novel strain of coronavirus, which was given the interim name of 2019 nCoV by the World Health Organization, later renamed as the SARS-CoV-2 by the International Committee of Taxonomy of Viruses. Some researchers have suggested that the human seafood wholesale market may not be the original source of the viral transmission to humans. Now let's have a comparison between these three diseases, the MERS-CoV, the SARS-CoV and the SARS-CoV-2. The outbreaks were accordingly: in MERS-CoV it was in June 2012, SARS-CoV was in November 2002, the SARS-CoV-19 that is in December 2019. The general fact that come in front of us is that the confirmed cases and the death rates are exponentially much bigger in case of SARS-CoV-2 than the MERS and the SARS viruses. But the symptoms that are dry fever, the dry cough, the diarrhea, the sore throat, the ventilatory support are most common in all the viruses of the human coronavirus strains. Chapter 2. The virus structure. Like other coronaviruses, SARS-CoV-2 particles are spherical and have proteins called spike protruding from their surfaces. These spikes latch onto human cells, then undergo a structural change that allows the viral membrane to fuse with the cell membrane. The viral genes can then enter the host cell to be copied, producing more viruses. Recent work shows that, like the virus that caused the 2002 SARS outbreak, SARS-CoV-2 spikes bind to receptors on the human cell surface called angiotensin converting enzyme. Chapter 3. Symptoms. Symptoms can include fever, cough, shortness of breath. Symptoms may appear 12 to 14 days after exposure. Seek medical advice if you develop symptoms and have been in contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. Chapter 4. The Fear.
Say it again. The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won.
So as you can see, the President of the United States, Donald Trump, has also said that the peak is yet to come, and it same reflects to India also. About 1,480 deaths are recorded in the US in the last 24 hours. That is a very big number in the case of death tolls. Now we'll be seeing that how coronavirus is increasing on per day basis all over the world, and the numbers are really shocking. The exponential growth of the number of coronavirus diseases in humans is really scaring. Chapter 5. The World into Action.
The spread of the coronavirus has passed a significant milestone in just the past few minutes. According to the Johns Hopkins University, which has become a recognized source of information in this crisis, there are now more than 1 million confirmed cases worldwide, although the true number could be much higher. The global death toll has passed 50,000 people. The UK wants to test 100,000 people a day by the end of April. Spain has registered 950 coronavirus deaths in just one single day. This is the highest daily number anywhere in the world. And in Russia, President Putin has extended the country's partial lockdown until the end of April.
Chapter 6. The Scenario of India.
निर्णय करने जा रहा है। आज रात 12 बजे से पूरे देश में, ध्यान से सुनिए, पूरे देश में आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है। हिंदुस्तान को बचाने के लिए, हिंदुस्तान के हर नागरिक को बचाने के लिए, आपको बचाने के लिए, आपके परिवार को बचाने के लिए आज रात 12 बजे से घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है।
Government has decided to seal the district borders. He's saying that the places, the districts where COVID-19 hasn't reached, we're ensuring that the coronavirus doesn't reach there.
आता ह्या सगळ्या वाहतुकीवरती बंधनं आणत असताना मी माननीय पंतप्रधानांना एक पत्र लिहिलेलं आहे आणि त्याच्यात मी ही मागणी केलेली आहे की आपण देशांतर्गत जी वाहतूक आहे ती बंद केली.
India is trying to fight hard so that it should not enter into the third level, in which most of the countries, the China, US, Italy, Spain, Britain are already in and are struggling to come out of that. To the country of 130 billion people, it is the only way that we need to stress to the people that they should really stay in their home, and prevention is really better than the cure for the COVID-19.
All across India, day laborers rushed to transportation hubs, carrying whatever they could. The nationwide lockdown has put millions out of work and started a mass exodus from the cities. For these people who are leaving New Delhi for their hometowns, the fear of starving is currently greater than the fear of infection with the coronavirus.
If we had food, why would we have left? We're not enjoying this. We know that a pandemic is spreading, but we were forced to leave. We're taking precautions and keeping as much distance as we can.
The government did nothing. Otherwise, we wouldn't have left.
India's efforts to contain the coronavirus have plunged the country into chaos. After transportation was shut down, some state governments arranged buses to bring migrant workers back to their home villages. But in other states, people were left stranded and forced to walk hundreds of kilometers home. Day laborers, street vendors, and other informal workers form the backbone of the Indian economy. With police chasing them off the streets and no savings to fall back on, the lockdown puts many of them at risk. Prime Minister Narendra Modi, who had ordered India's 1.3 billion people to stay home, has apologized for the hardships they are now facing.
Especially when I look at my poor brothers and sisters. I think they must be wondering what kind of prime minister I am, who has put people in such a difficult situation. I especially ask for their forgiveness.
So far, roughly 1,000 people in India have tested positive for coronavirus, but experts worry numbers could be much higher. Fears are that an outbreak in one of the world's most densely populated countries could result in a catastrophe.
Chapter 7. Myths. In today's world of social media, lots of myths are going around the people. But these are the facts. The coronavirus can be transmitted in areas with hot and humid climates. The coronavirus cannot be transmitted through mosquito bites. There is no evidence that companion animal pets such as dogs or cat can transmit the coronaviruses. Ultraviolet light should not be used for sterilization and can cause skin irritation. Thermal sensors can detect if people have a fever but cannot detect whether or not someone has the coronavirus. Vaccines against pneumonia such as pneumococcal vaccine and hemophilia, influenza type B vaccine do not provide protection against the coronavirus. Antibiotics do not work against viruses. Antibiotics only work against bacteria. To date, there is no specific medicine recommended to prevent or treat the coronavirus. Chapter 8. Some question and answers. Chapter 9. Precautions. Avoid close contact with people who are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Avoid touching your eyes, nose and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you are sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. Chapter 10. The final message. Cough and sneeze into your sleeve. Hashtag stop the spread. Stand together by not standing together. Hashtag stop the spread. Hashtag stop the spread. Spread kindness instead. And at last but not the least, don't wait, self-isolate. Hashtag stop the spread. The first line into the preamble of our Constitution says, "We, the people of India." And now it is the time that we show that we people are united and stand against this disease. We all are today in a lockdown phase. But we'll have to look at the positive sides of it, because we really don't know till when it is going to be exceeded. It has really taught me that the real life essentials are very low. The time that now we are getting with our family will be the time that we will never get in our life. It has really taught me that how much we really used to love our work, our college life, our school life, our friends. I really request to the one who is listening to it that please donate, help the poor one, help the needy one. There are a lot more who are really suffering more than you. Show respect and gratitude towards our policemen, towards our doctors, our nurses, and to everyone who is making this lockdown successful. A really big thank you to you that you stayed in your home becoming a soldier in this war, and our country is really going to win this battle. Please, please stay home, break the chain, make India corona free, and we will win it. We will definitely win it if you are at your home. Stay safe, stay home. Thank you.